I am Dr. Bushra Herieka, consultant physician in genitourinary medicine and HIV in Bournemouth Hospital in the UK. I've been born, bred and educated in the Sudan, graduated from the Faculty of Medicine, Khartoum, many years back, after which I migrated to Saudi Arabia for some money and eventually to the United Kingdom for postgraduate studies, and I specialize in HIV medicine. HIV is a fascinating disease. Since its emergence in the last 25 years, it has claimed many lives, and it is still claiming more. It helped in doing so by the enormous stigma surrounding the disease, and that helps it to quietly select its victims and continue killing them. Like most expatriates, I dreamt every day of coming back to Sudan and doing something to help my country in fighting the epidemic of HIV/AIDS. And I made the first contact with the Federal Minister of Health in Khartoum through SNAP, Sudan National AIDS Control Program, and I met very genuine people there who welcomed my approach and said, we are happy for you to come and contribute to our efforts in fighting HIV/AIDS. Then from there, we looked for ways of doing work together. A quick assessment revealed there are two areas that need some work to be done. Firstly, capacity building, as we quite clearly find out that there are very few frontline staff and clinicians who can deal with HIV/AIDS. Secondly, there is a need to assess the infrastructure, the settings available for diagnosing, treatment and management of HIV patients. From there, we moved together and they introduced me to Sudan United Nations Development Program through its department, TOCTAN, or Transfer of Knowledge Through Expatriate Nationals. There also I found very genuine and very helpful people, and went back to UK, founded with my colleagues the Sudan HIV/AIDS Working Group, which is Sudan, which is SHAWG, shawg.org. And that is a vehicle to try through which channel our efforts to help the Sudan National AIDS Program in its fight against HIV/AIDS. United Nations Development Program, through its branch TOCTAN, sponsored our activities to conduct a workshop for clinicians and physicians and frontline staff in Sudan. We managed to gather around 60 clinicians from the different parts of Sudan, mainly the 15 northern states. It is July-August 2008, and it was for 8 days. It was an intensive course on how to diagnose, manage and treat HIV. And that meeting helped us also to realize the enormity of the task ahead of us all. And the feedback from that meeting was great, as many of these people fed back to us through the evaluation form, saying they learned quite a lot from that workshop. Some of them even said this was better than many conferences they attended overseas. We were a group of four, myself, Dr. Zahir Osman Al-Tahir Babikir, the Secretary of SHAWG, Dr. Hamad Al-Nil Abdul Hadi, and Dr. Jibril Al-Goni, Abdul Karim Jibril Al-Goni. The four of us conducted this workshop, and add to it we had an opportunity to get access to the infrastructure. There visited few VCTs, that is voluntary centers for testing and counseling of HIV patients. We also had the opportunity to get to visit some people who are working in the area, and that helped us to write out recommendations for the management of HIV/AIDS in the Sudan through our document, The Way Forward, which is available in our website, shog.org. I think TalkTon is a very successful program, and it helped many, I know it helped many people to come back and channel their services and efforts to help the country. One thing that I would want to say about the program that needs to be, there could be an area of improvement in that area, which is the continuity. We know that many great projects in the world have failed to succeed because of their lack of continuity. And I know that TalkTon and UNDP can only sponsor a program for once. I think they need to look at that again and may need to sponsor it a bit further. Also another small point that I want to mention, many of my colleagues also at the end of their assignment said the money they were paid is a bit too much. They thought if they were given the option of donating it to a charity of their choice, or they were just given a certificate to show that they contributed in something, that would be more than enough. And at the end, I would not forget to thank the great people of TalkTon. They are all stars, and thank you very much for what you've done.